In any case, today I actually would like to talk about two things: pain and infection. Very cheerful subjects for a Sunday afternoon here, but actually very important in the terms of the history of medicine, and important for us today as well. When we go to the hospital today, we have certain expectations, right? We assume that if we're going to have an operation, we're not going to be awake during the operation. We're not going to suffer pain while we're being operated on, okay? The second expectation we have is that if we survive the procedure, when we're done, we're not going to die of hospital fever, it used to be called, or infection, okay, gangrene, that kind of thing. These expectations are very new. They're new to the last 100 years, and it's due to two important discoveries that were made in the 19th century. The first was the discovery of anesthesia, and the second was proof, because people had an idea before that there were small microorganisms that cause disease, but they actually proved that germs cause illness. So all of the bacterial soaps you see today and that kind of thing is a direct result of the discoveries that they made then, because before that they didn't understand that connection. If you'd actually like to turn on the slides, we can start with those. I just want to give you an idea. They did have some forms of pain relief, obviously. As far back as the 1st century BC, people would drink wine of mandrake root, or later they would use opium, or alcohol was a very common thing to drink if you did have to have an operation. Sometimes they would go so far as to use asphyxiation. They would try to strangle you partially so you wouldn't suffer so much. And later in the century, actually, they tried hypnotism, but that didn't work as well. To give you an idea, most surgery, if it was done before the 1800s, was minor surgery, okay? There was great fear about going into the chest or the abdomen, because if you did that, most people died, okay? There was no way of opening a body up and not having it become infected, so it was not something that was done. So most surgery was minor. It involved surface tumors. They might remove those, or draining abscesses, or removing fingers and toes, perhaps from frostbite. And this is a typical scene of what surgery would have looked like, actually, before the 19th century. This is actually 1809, so the very beginning of the 19th century. You'll notice a couple of things. First of all, it's in a private home. So most times either you went to the surgeon or the surgeon came to you. But in most cases, they used whatever surface was available. In this case, it looks like maybe a dining room table or a side table that was brought into the bedroom. You'll notice that the woman is being operated on, but she's very much awake, and somebody's trying to hold her down, okay? You'll notice that the doctors and his assistants are dressed in street clothes. They're wearing frock coats, although the man over there does have an apron. And really, there's no other kind of antiseptic, what we would call, methods being used here. This is actually, it's a little bit unusual because it's a picture of the first successful abdominal surgery, which is 1809. So thousands and thousands of years this wasn't possible. And this was probably a success by chance rather than by anything else. This woman was from Kentucky, and she had been suffering from diseased ovary, actually, and she was about to die, essentially. And the doctor said, well, if you're willing to come out and see me, because he lived about 60 miles away, I can try to operate, but you will surely die. Okay, he was very straightforward about it. You can't do this without risking death, essentially. But as she was going to die anyway, she did it. She waited until she felt well enough. She took a horseback ride for 60 miles, went to the surgeon. The surgeon operated. She, because, again, there was no anesthesia, she recited psalms through the entire operation. They removed a diseased ovary that weighed 20 pounds, okay? The woman recovered. 25 days later, she was able to take a horseback ride back home, and she lived another 31 years. But this was the exception, okay? It was very, very unlikely that you would survive something like that. So she probably had a very strong immune system, is what was going on here. If you'd like to go to the next one. So the first major revolutionary advance in medicine here was then the discovery of anesthesia. Okay? And this has a very odd story. Nitrous oxide, or laughing gas, which we usually see used in dentistry now, was actually discovered at the end of the 18th century. But oddly, its applications for medicine weren't taken advantage of for, I believe, 40 years. It was discovered by a man named Priestley, and another physician named Humphrey Davy noted in 1799 that it seems capable of destroying pain and might probably be used with advantage in surgical operations, but it wasn't. Instead, people had parties, nitrous oxide parties. And so for the first 30 years, from like 1800, from the time more or less it was discovered, until the 1840s, genteel people would gather and they would have laughing gas parties and they would breathe in laughing gas. Or you could go to the fair and you could go to a nitrous oxide booth and you could try laughing gas. Or you might go to a certain house of entertainment and there you would also be able to breathe in laughing gas. But nobody thought to use it for surgery or for dentistry. In fact, there's this wonderful quote from this woman who again is writing in 1799 saying, "It provides indescribably exquisite sensations." Or here, as you can see, it's used as a prescription for scolding wives. And this here is a print from 1830. So essentially it was used as a toy. Okay, nobody thought to apply it to medicine. Ether, if you want to go to the next slide, ether actually suffered much the same fate. It was discovered in 1815, but instead of being used here, as we'll see in a moment, people had what were called ether frolics. They would again have dinner parties or in the evening entertainment, and they would breathe in ether. And it was provided these nice sensations. And so I guess, at least I never think of early 19th century people as doing things like that, but they certainly did. It was very popular among all classes of people. And then finally, what happens, which is partly what you see here, is somebody does get the idea, well, perhaps this could be used in surgery. And the man who's credited with first using it in surgery was actually a man from Jefferson, Georgia, just a local family physician named Crawford Long. And he used it to operate on a boy in 1842. So again, 30 years after it was discovered. He wasn't a fame seeker, so he kind of fell out of notice and nobody heard of him again. Anesthesia was actually first used in dentistry and first used in the United States by a man named Horace Wells. And he was so in love with the nitrous oxide experience for dentistry because it made his patients so much more comfortable that he thought he would do a public demonstration. And so he set up this whole public demonstration. This is not it yet. And it went wrong. Okay, there were complications from the nitrous oxide. And basically it was a complete failure. He was ridiculed. And he later committed suicide. This is also a pattern you're going to see emerging of medical men making wonderful discoveries, trying to present them. They get ridiculed, they get attacked, and they die or go insane or commit suicide. It was actually more common than you would think. His partner, Horace Wells' partner, after he committed suicide, a man named William Morton, he had gone to one of these ether frolics, these ether parties, and had thought, well, maybe with the complications of nitrous oxide, why don't we try operations using ether instead? So he was a little bit smarter than Wells, and he practiced first. He did a few operations with ether before deciding to go public. And then you have here pictured the first successful public demonstration of an operation using ether or under anesthetic. And so this is actually from 1882, so it's a very romanticized vision, okay? It's very clean, it's very sane, it's very calm, it's not chaotic. Generally, that wasn't the kind of scene you would find. This was at Massachusetts General Hospital in October of 1846, so middle of the century. And they're doing an operation, on the neck of a young man named Gilbert Abbott, or Abbott Gilbert, which was it? Gilbert Abbott. And they've done an incision into his neck. So this was very revolutionary. Now you're not present mentally when you're being operated on. And it's very, very much easier for the surgeon as well. Morton, however, was a fame seeker, and he wanted to make a lot of money. And so he thought, I've demonstrated this and with great success. Now I'm going to keep ether a secret, and I'm going to make a lot of money. So he tried to disguise ether by giving it a different scent and by coloring it and calling it Letheon, which I think is a horrible name, not very bodes ill. But in any case, people caught on right away to what it was. Ether has a very particular smell, and they knew what it was, and other people began to use it. Typically, though, you would think that when you discover something this wonderful, it's used immediately. And in fact, that's not the case. This, again, is 1846. If you look even at the Civil War, for example, during the Civil War, ether costs money. Do you provide anesthesia to soldiers? Do you provide anesthesia to poor people? Okay, these are all issues that come up. What does change, though, is that new kinds of surgical procedures can be developed because the surgeon has time to operate for the first time. He doesn't have a screaming patient there. It also changes, perhaps you could say, it changes the kind of people who could become surgeons. Before this time period, you had to be very fast, right? Nobody wants to suffer a long time. So if you're going to be a surgeon, you have to work quickly. If you're going to be a surgeon, you would need to be able to make decisions quickly. If you're going to be a surgeon, you needed to not mind causing people a lot of pain. And not everybody could do that. There are a lot of stories about young men who go to medical school, realize that being a surgeon is perhaps not their cup of tea, and revert to being family practice or to doing things that do not involve surgery of this kind. So this opens up a lot of possibilities for people. You're going to go to the next slide. This is chloroform. A similar thing happened with chloroform. Essentially, it was discovered in 1831, simultaneously in France and the United States. And it was considered better than ether and particularly good for women giving birth. However, despite the fact that it was this wonderful thing, it wasn't immediately adopted by any means, partly because there was a lot of religious feeling that women should not receive anesthesia in childbirth. It was against the Bible, against the rules of the church, and the Calvinist fathers at the time were very much against it. Again, you get into issues of gender and class and finances. Here you'll notice this particular illustration is from a book from 1858 by John Snow on chloroform. And the woman here is kind of delicate and sort of refined and upper class looking. And that's basically who he was advocating chloroform be used for. Country women, women of color, poor women, none of these women really needed this, okay? And the thinking of the time, or rather, those are the kind of issues that were brought up. So these kind of discoveries didn't automatically mean that everybody who needed it or wanted it could obtain it, okay? So there were a lot of issues going on here. Chloroform actually gained acceptance for women in childbirth with Queen Victoria. Her physician, John Snow, was called in to help her during the birth of her last two children in 1853 and 1857, so 20 years after the discovery of chloroform. And she accepted chloroform during the birth of those two children. And once Queen Victoria had accepted chloroform, then it was okay for other women to accept chloroform. So actually, her acceptance of it did a great deal towards allowing its use for other women in the population. In any case, by 1831, all three of these basic anesthetics had been discovered, but most of the applications and most of their use didn't actually develop until the 1840s, 1850s, right in there. What happens next, however, is that now you can keep people out while they're being operated on, and you can correct a lot of conditions that were incurable before the advent of anesthesia, because now you can keep people under longer. The problem was you're curing people with the procedure, but they're dying afterwards of hospital fever. Okay, so you've got one part of the problem taken care of, but all your patients are, generally speaking, still dying. So the next major revolution, let's say, in medicine is the discovery, essentially, that germs cause disease. If you want to go to the next slide, thanks. This is what I've called sort of the great soap and water debate, in a sense. Up until the 19th century and through the 19th century, people had certain beliefs. One belief was in spontaneous generation, which means that they thought that when something was decaying, bacteria grew out of chemical processes within the meat, for example, itself. They didn't understand that those microbes were already present. The other issue that occurs over and over again, is particularly strong in the 19th century, is that there's this argument between the idea that disease is caused by environmental conditions. For example, they thought that yellow fever was due solely to temperature and humidity changes, or the idea, or bodily imbalances. Okay, so there's something out of humor. Or the idea that disease was contagious. So these are sort of two conflicting ideas. One is this environmental bodily imbalance, and the other is the idea that actually disease is something that can go from one person to another. Okay? So for example, in the 1700s, people in hospitals would be put in the same bed. You would have 2 or 3 patients to a bed, and there was no idea that what one patient had might pass to another patient. Okay? So it's a very hard for us to understand because it's so much a part of our culture, but not theirs. So this man, his name is Semmelweis, and he was Hungarian, actually, working in Austria. Usually, a man named Pasteur is credited with discovering this, but there were a lot of people through the century who worked on this idea about germs and contagion, and he's one of them, and I think his story is not as well known, so I wanted to tell you it. He worked primarily with childbed fever. It was very common then if women started actually go to the hospital to have children, and when they would go to the hospital, it was unfortunately possible, and likely in some cases, that you would die of what was called puerperal or childbed fever afterwards, which was a blood infection that was lethal, essentially. So he was one of the first people to advocate washing your hands. Again, this is something that for us it seems very obvious. We wear gloves, we wash hands, we use antibacterial soap, but for them, washing their hands was a new idea. They didn't between seeing patients. They didn't wear gloves. They used the same instruments. They would go from one patient to the next without washing the instruments. So you have a tremendous opportunity for disease to get passed between people. So he was one of the first people to work on this. If you want to change the next slide. He worked again in Vienna, Austria. This is called the Allgemeines Krankenhaus. Hopefully I've pronounced that right, the General Hospital in Austria. And there were two wards, two obstetrical wards. And he noticed there that there was a distinct difference in mortality rates among new mothers on these wards. And you have to understand that in the 19th century, there was a new statistical spirit of analyzing data, of trying to figure out what exactly is going on. Well, Semmelweis noticed that the mothers on the ward where the medical students were being trained had a higher mortality rate than the mothers on the ward where the midwives were being trained. Some other person might have just thought, well, maybe the midwives know more about what they're doing. But he didn't. He said, let's actually take a look at what's going on here. Let's see what the mortality rate is like, and let's see what it's coming from. So he looked at them, and it turned out on the ward where the medical students were being trained, the mortality rate of the mothers was over 10%, sometimes reaching 20% in certain months. Very, very high, okay, very high. And he found instead on the ward where the midwives were being trained, the mortality rate of mothers never even reached 3%. So he started to look at the situation, and he also realized two things, essentially. The medical students were coming directly from the autopsy room. Okay, so they were coming from dissecting cadavers, and they were examining mothers who had just given birth without washing their hands. And he also discovered that the mothers who died, if you looked at the wards and the lineup of the beds, the women who became infected were infected along the route of examination of that day. So it's fairly apparent to him that it had something to do with these medical students coming in and examining them. So the first thing, the midwives, on the other hand, did not do dissection. Okay, so they were never involved with dissecting dead bodies, and they came directly from elsewhere. They didn't come from the autopsy room. So the first thing Semmelweis did was to require hand washing. Not a very big deal, but a huge deal. Okay, to us it seems obvious. Again, to them this is revolutionary. Okay, he required that all of the students, all of the doctors under his supervision would scrub their hands with soap and water and rinse their hands in a chlorinated lime solution before each patient, so between examination of patients. Nobody liked this. Nobody liked it. Everybody complained. It was a pain. Okay, it didn't make sense. He received a lot of complaints about this, but what was once an 18% mortality rate among new mothers dropped within a few months to 1 2/10%. Okay, huge drop in mortality rate. So you think, I want to change the next. This is actually Semmelweis's basin that he washed his hands in and required his students to. You would think, given that kind of drop in mortality rate, that the rest of the hospital staff would be very enthusiastic about the idea of washing their hands and treating their instruments in their hands with this chlorinated lime solution, or at least conducting further study to examine what was going on, further clinical proof of what Semmelweis had discovered. Instead, that didn't happen. What happened was the chief of service at the General Hospital, who it appears out of personal antagonism, condemned Semmelweis, lowered his rank, and reduced his visiting privileges. Okay, not uncommon. Again, this idea gets attacked. Semmelweis presented his findings to the Medical Society of Vienna, where he was viciously attacked. There were a few people who supported him, but not very many. At this point, the poor man is broken. He goes back to Budapest, where he does amazing things in the maternity wards there, saves a number of lives by changing the practices there. And finally, in 1861, okay, 10 years after he's doing this work in Vienna, which he was doing in the early 1850s, he publishes a book about his work. It goes unnoticed by the profession, and it's actually prestigious scientists of the day actually opposed his ideas. Okay. Again, it doesn't always make sense to us, but they're working in a different mindset, and these are new ideas. The idea that you can transfer disease is a new one, in a sense. The poor man, Semmelweis, he ends up going insane. He gets committed to an asylum, and he dies in 1865 of a blood infection, essentially the same thing that he was trying to prevent from happening to the new mothers in Vienna. So it's kind of an ironic and sad story in that sense. Nonetheless, I guess today, you could say there's some fame, he is credited with, for the first time, developing a statistically tested system of asepsis. And asepsis just means killing or excluding germs before they enter. We hear the term antiseptic a lot, and that means killing them once they're in there. Okay, but asepsis is preventing them from entering, actually. Before the germ theory had actually been proved. And again, a Frenchman named Pasteur was credited with developing this germ theory, but not until somewhat later. So Semmelweis's work was before that. If we go on, I'm going to turn to the next one. Another important man was a man named Joseph Lister. I've always wondered if the word Listerine comes from this. Yeah. It probably does, is my guess. He was a prominent Glasgow, from Scotland, physician. And he is working around the same time, and he's actually credited with establishing the first antiseptic procedures, okay, so killing things once they're in there. This is his carbolic acid spray. What he advocated, he'd read the work of Pasteur, so he knew about this idea about germs and things, and what he advocated was a use of this carbolic acid spray that you would spray while you were doing surgery. Or you would use soaks. For example, once you were done operating, you would take the bandages and soak them in carbolic acid and actually put them on the wound, which apparently was very painful because it's a corrosive substance. So while you're operating, you'd have the spray going, which apparently was also very uncomfortable for the physicians because they're breathing it in. It's very strong. It did help. Again, the mortality rate dropped significantly. But if you look here, you'll notice that the physicians are still operating in street frocks, okay? Often they use their very oldest frocks because obviously you don't want to mess up a nice new one. They're frock coats. So these were frock coats that also in some cases had seen a number of operations, again, very unsterile conditions. No masks, no gloves. You have the idea of antiseptic surgery developing, but very far from what we would find normal today. He too published. He published in 1867 a report in The Lancet, which is a well-known medical journal, about these findings and encouraging the use of the carbolic acid and the bandage soaks. He too was actually received with indifference and a lot of hostility in most cases. It took really until the 1880s, okay, so another 25 years, before the majority of physicians started to adopt his ideas. Okay, again, a very long time coming. Despite the drop in mortality rates. It did take that long. If you want to go to the next one. There's a famous physician, a famous U.S. physician called Samuel Gross, and this is actually a fairly well-known painting by Thomas Eakins of 1875, showing the Samuel Gross Clinic. Here's Mr. Gross with the gray hair, performing an operation. He was one of the leading surgeons of his day. And he, 9 years after Lister's publication, so again in the 1870s, he writes, "Little, if any, faith is placed by any enlightened or experienced surgeon on this side of the Atlantic in the so-called carbolic acid treatment of Professor Lister." So he did not believe in Lister's principles, and in fact, if you look here, there's no carbolic acid spray. His bandages and soaks are no doubt just straight. You find a lot of lookers-on here, completely off the street in street clothes. They are all also in street clothes, no masks, nothing different. If you can look also a little bit at the, I don't know if you can see them that well, it's a bit hard to tell. The instruments are also, look like they might be bone-handled, okay, which is something we'll look at again soon here. If you want to go to the next one. So change is very slow to come. This is a picture from Iowa, okay, from I believe it's 1895, 1896. It's a surgical clinic in Iowa in 1895, so again, many years after Pasteur, many years after Lister. You don't see in this particular photo any carbolic acid spray. Most likely by this point they are using bandages soaked in that. But again, you'll notice that only the surgeons at this point are wearing operating garb. It's a start. In the previous ones, nobody was wearing operating garb. So here the surgeons have operating garb on, but you again have a whole host of onlookers who are in street clothes. Still very essentially unsanitary conditions from that point of view. And again, still no masks or gloves or anything else that we would associate with an operating room today. What happened was even the physicians who believed Lister and said, okay, we need to use these antiseptic sprays, they kind of missed the point, essentially, because they concentrated on the spray and didn't realize that you use the spray because of the idea that foreign substances or foreign microorganisms could enter a body or a wound while it was being operated on. So they kind of concentrated on the spray and failed to elaborate on that to the idea that maybe what we're breathing or maybe what we're touching or maybe the clothes we wear might also be contributing to that problem. So it's kind of a strange situation from that sense. If you want to go to the next one. So as Lister's principles of antiseptic surgery took on, and as people realized that it really did make a difference in mortality, right, you start to see a lot of changes. Here, this is actually the beginning of the 20th century, right around the turn of the century here. You have all of the doctors and operators here in operating garb. They have hats on. Here you can, I don't know if you can see it very well, but they are wearing rubber gloves, actually. And the man operating, the one on the center, his name is William Halsted, and he's credited with using rubber gloves for the first time in surgery. The story is again a little bit ironic. He advocated the use of rubber gloves for his operating room nurse so that she wouldn't ruin her hands. And he later married her, okay? But a student of his said, well, why don't we all use them? Because these rubber gloves you can sterilize, and it seems like it would be an intelligent idea to do that, which is what happened. They started to use them. Even then, though, most surgeons didn't adopt them. Partly because of the turn of the century, the rubber gloves were not like the gloves that you see in an examination room today. They were rubber. They were very thick. They were very awkward. You couldn't feel very well. They were stiff. Surgeons felt like they lost a lot of their ability to touch and things. So a lot of people still didn't adopt them because they were just hard to work with. That will change as the technology of gloves changes as you go through here. Again, no masks yet. We still haven't gotten that far, but we're getting there. If you want to go to the next one. This is again actually at the State University of Iowa. This is an operating theater in 1909. You see again many more changes in the sense that you now have what looks more like a sterile environment going here. You have a lot of enamelware basins as opposed to things like wood. Okay, you have most people in surgical garb. You have this nurse here in the front who's still wearing her traditional uniform, but the other nurses are in surgical garb. You have the use of gloves, and you have hats again. As well as a tile floor, which is easy to clean up, and white. The actual green operating garb doesn't come into use until much later. What happened was the white was too bright, and it kind of blinded surgeons. So after a while, they started trying out different colors to see what worked well in surgery, and they finally discovered that green worked really well because it contrasts with red, the color of blood, very well. So it was easier on the surgeon's eyes, and also easier for them to see what they were doing. If you want to go to the next one? Yeah.
Is that a room without a ceiling, so you still have an audience?
Yeah. Up here, it's what's called an operating theater. So up here you actually have all seats.
So that they moved by a window or by a pane from?
No, it's open. It's still open. Still open. You would still have medical students or others sitting up there to observe the operation. Yeah. So we're still not to the point where it's that kind of closed and sterile environment. So you'll also see the anesthesiologist, I believe, here at the very front. You can't really see it too well, but they would have a mask over the face that they could then drip the anesthesia on. So if you want to go to the next one. This is a year later. It's again in Iowa. It's 1910. And you'll see all of a sudden we have the masks now coming in, much more official operating garb, and yet the anesthesiologist doesn't have a mask or gloves or a hat, or the man behind him, or the sister further behind him. They're all in the sister's in her regular clothing. But the surgeons have the masks and the hats. Even the history of masks is interesting because they started wearing them over the mouth, but up until the 1940s and the 1950s, many surgeons only wore them over the mouth. Nobody wanted to cover their nose. So that took a long time as well. The other thing you'll actually notice here, if you look at my stuff in front of you, if you look at the instruments on the table, they're all stainless steel. This is a major change in instrumentation. I'll show you some examples here. Up basically until the 1880s, a lot of surgical instruments had parts that were made out of ivory, parts that were made out of ebony, parts that were made out of tortoise shell, other kinds of woods. All of these things, hard rubber, things that are very difficult to sterilize, right? So you don't throw these things into any kind of sterilization. With the understanding of Lister's principles, you find the use of stainless steel coming into play. Some physicians would still use the older instruments, but did start to do things like boil them until they fell apart, or otherwise treat them chemically to make it safer for the patient. But it is a major change there. You also find in the old sets, like from the Civil War, you have these amputation sets that are beautiful. They're elegant. They're lined. They come in silk and velvet-lined boxes with brass things on the side and engravings and all of these very beautiful presentation, but terrible from the point of view of saving your patient's life. Okay, you can't sterilize anything like that. So that's actually all the slides I have. If you want to turn that off, I'll show you some of the artifacts that I brought in to show you the difference between the two here. I actually brought one of the oldest surgical instruments known to man, or actually a family member of it. It's called a trephine. And this one has an ebony handle, you can see here, and it's got this cross-hatching, which might be difficult to see, but it's got cross-hatching carved into the wood. Very typical of the Civil War era. This is probably from about the 1860s. It was used to make a hole in the skull. Okay, in the center, there's a small pin, and you would use that just like a carpenter would to begin a hole. It could be retracted using this thing here, and then this bore, essentially, you would go into the skull and carve out a hole. People did this for a couple of reasons, okay? The first was if you had a skull fracture, you would need to elevate the splinters or remove them. And so that's partly how they would do it, okay? That was the most recent use, so often in cases of war or accident. In the past, actually as long as 4,000 years ago, they used something similar. It was more in the shape of a circular or like a crescent-shaped knife. So not quite the same thing, but it's what this develops out of. Used for the same purpose, basically, to pull out fractured pieces of skull. It appears that as long as there has been humanity, people have liked to hit each other over the head, which is probably why this is one of the oldest things we have. But they found evidence of that in like 4,000-year-old Peruvian skulls, and they find that like 5 to 6% of them have had this done, and that they think there was a survival rate, oddly, of like 75%. So part of it was for medical reasons. Part of it, religious reasons might be another reason, to remove evil spirits or allow them to escape. Or third reason would be to relieve pressure due to like brain tumors, or even in cases of extremely severe headaches. Okay, so this was something that was used actually up until 1915 in very much the same form. Again, this is 1860s. I brought one from 1915. Looks very much the same, except that you'll notice it's all stainless steel. Okay, so it can be sterilized after you've had a hole drilled in your head. But again, you have the bit in the center, and then you just turn it. Those are a couple of things. I also brought, and you're welcome to come up in a few minutes and look at these, but I brought a traveling surgical kit. This would be a saddlebag kit for doing surgery. Again, when the surgeon would go to a person's home, or when you would go to the surgeon perhaps, although he'd probably have different instruments at his own office. This, again, is very early, probably 1850s or 1860s. You'll notice it has a velvet-lined interior. It's a leather case. It has silk flaps, which is a very elegant presentation. All of the instruments, or most of them, are in a kind of penknife format, and they're tortoise shell with small brass hinges. Very beautiful, not terribly good in terms of asepsis and antisepsis. So I laid a couple of them out here. A couple of the scalpels also have wooden handles, which you're welcome to come up and look at. So again, this is from mid-19th century. Here's one from just after the turn of the century, probably up until about the First World War. Again, it's hard for me to hold up all the way, but it's all stainless steel. So you have the stainless steel box and then all of the stainless steel tools. It comes in a handy leather carrying case, which looks like a coin purse, okay? So it was still something that a physician could carry with him to somebody's home, which was fairly normal up until fairly recently. The other two items I brought were about anesthesia. This is actually, let's look at this one. This is from about 1900, and it's an ether inhaler for use by women in childbirth. Okay, what they would do, these are for your nostrils, okay? They would take a piece of cheesecloth and soak it in ether and put it inside there, and then the woman could just use it as she needed it. And I've heard, and I'm not sure this is the case, I've heard it was useful because if you got too much, it fell out of your hand, and so essentially you couldn't get too much by doing it that way. But it was also something that the woman could regulate then, in a sense. And then this is a later one, actually a form that was in use for a number of years. So this could be from anywhere between about 1900 and 1920. It folds down, which is very nice. And again, this was when anesthesia was still dripped onto something. You'd put a piece of cheesecloth over this. The anesthesiologist would drip the ether or the chloroform onto this, and your patient would stay out. Later, it went to a closed system, which also helped the people in the operating room, I'm sure, so they weren't getting any of the side effects of the ether or the chloroform there. Does anybody have any questions? I realize that was kind of a whirlwind tour, but...
After they were through with the carbolic acid, then what came on for the antiseptic? I'm leading up to sulfur.
Yeah.
When did...
I don't know in terms of chemically what was used. I know that people started boiling things a lot more and designing instruments that could be boiled. Essentially, you can treat things chemically or you can treat them with heat. And I think there are a lot of actually traveling steam machines or instruments that you could put your instruments into to sterilize them between patients.
Yeah, but how about spraying the area where you're going to operate?
I see. I don't know.
When did sulfur come in? During World War II, shortly before World War II?
You know, I honestly don't know.
And then after that, the antibiotics.
Yes.
I do remember my parents during World War I always talked about carbolic acid.
Okay.
But
Wow,
then
that's amazing.
What's happened between that and sulfur?
You know, I don't know. I'd have to look it up. I'd have to read more about it.
I'd say a lot of it probably was just technique and procedure. Keep in mind, sulfa and the penicillin antibiotics are actually drugs used to treat infection or obviously used to prevent it also, whereas the carbolic acid or the phenol is actually used to sort of clear it out, disinfect it. So those are two different uses actually of chemicals.
That's what, your parents talk about it? They still remember that though? They
Yes.
used it? That's really amazing. It's wonderful. Does anybody have any other questions?
When did the anesthesiology field start as a specialty and not just as a subfield or
The end of the 19th century, it's when a lot of specialties started to occur. Not only anesthesiology, but gynecology, dentistry is a separate field. A lot of times if you needed a dentist in the past, you'd go to your family doctor and he would also extract teeth. So all of those fields started to diverge through the course of the 19th century, but definitely towards the end.
When you were talking about the midwifery, why were they washing their hands? Why were the midwives washing their hands?
Okay, the midwives weren't, necessarily. No, it was just where they had been previously, and the fact that really hand washing wasn't a part of the common procedure of that time. Because if you don't know that that's important, you don't do it. So it wasn't so much that the midwives did that or didn't that. They probably didn't, to be honest, but they hadn't come from dissecting bodies. Okay.
How did they respond to the chloroform and the options for painkillers that the doctors are starting to use in the maternity wards?
I don't know. I know that there's a lot of friction between doctors and midwives. It's a time, actually, of the sort of course of the last 150 years probably, where there's a division. Most women used to go to midwives. It was considered a normal thing. It wasn't considered an illness or something that you would go to the hospital for. And then over the course of the century, as the medical profession became more respected and as medical schools became more established, because that was also a factor in medical education, more and more women began to go to doctors to have their children probably because of a lot of reasons. They probably felt it was safer in some ways. A midwife might be fine until there were complications. If there are complications, what do you do? You have the physician. There are always stories. Everyone's always going to have a story of somebody they knew who waited too long to call the doctor. At that point, when it's your turn, you say, maybe I should have the doctor there a little earlier. Maybe I'll just have him there from the beginning. So you get that going on. I've heard it also said that part of the incoming of doctors also had to do with when there were complications. What had to happen was often not very pretty. You often, before the use of anesthesia, you had to choose between the life of the mother and the life of the child. And midwives, one woman theorizes, didn't want to be part of that. It's nasty. You can try to do a cesarean, but the woman will no doubt die. Or you can try to remove the infant in pieces, and then the infant dies. So at that point, why not call somebody else in to do that? So I think there's this kind of friction. I don't know what their take would have been on the chloroform or ether. I don't know that there are records. I'm sure there must be, but sometimes those things also get lost in history. So it'd be interesting to find out, to learn more about it. But yes?
How would they take the pain before the antiseptics?
Before anesthesia? How would they deal with it? Well, sometimes it depends. They could do a few things. Sometimes people would drink a lot before they had an operation, so you'd get really drunk. Yeah, alcoholic drinks. Yes, not water. You drink a lot of alcohol. It wouldn't knock you out, but it would make you at least a little bit stupefied or a little bit dumb in a sense, so that you wouldn't suffer so much in theory while you were being operated on.
They did that in the Civil War.
Yeah.
That didn't do any good. They hit them
Definitely.
Club.
Well, then they'd have to use one of these. They would try things like asphyxiation and other things. Sometimes an opium and different, yeah, exactly. There are some other possibilities there as well. Earlier than that, when those things weren't available in our culture, you used what you could use. There were some other herbal remedies or herbal concoctions that would have that kind of effect, but not to the same extent. A lot of times you just tried to make it as short as possible if you were the surgeon, and it was 15 minutes of sheer agony, and then it was over, and hopefully you lived. So it was very different. Surgery, that you have to understand, was a last resort, okay? That kind of surgery would be a last resort. You were going to die anyway, okay? So it either is, at that point, you might be willing to suffer that much for 15 minutes if you have the option of living, okay? So it was very different. It was very painful, very uncomfortable. Yes. Bite on anything, pieces of wood or bullets or
stick or something and put it across in their mouths.
Exactly.
Bite on them. Yeah.
Exactly. Or like our poor woman here reciting psalms. I would have bit on something instead. but whatever it took for you to get through it was what you did. So whatever was source of most strength or whatever got you through it. Good question, though. Any other questions? Okay, I'd like to actually invite you up to look at these things. I ask you not to touch them because the oils and things from your hands can damage the artifacts, but you are welcome to look at them. And I have a couple of brochures, too, from the Medical Museum, so hopefully you'll come by and say hello.
If you haven't been to the Medical Museum, it's worth the hassle of the parking ramps and getting lost in the hospital to go over there.
Yeah, find your way around.
There's actually a good exhibit right now on the century of caring in Iowa, so the last 100 years here. So thank you.
She needs directions. Do you want to give directions even when you're being taped to where they can find the Medical Museum?
Yes, yes. Okay, our hours.
It wasn't too big anymore. I was a patient there in 1969.
Uh-huh.
It was bad then.
Oh, no, it's gotten much, much bigger now, yes. You actually, if you go to the hospital, you can park in, I think probably,
I walk.
you walk. Okay, if you get inside the hospital, you need elevator F. That's the only thing you need to know. You can ask directions, or they're alphabetical. Elevator F, and you go all the way to the 8th floor, and then there are signs. It's right there on the 8th floor.
Yeah.
And we're open.
After that, it's easy.
Yeah, after that, it's pretty easy. We're open from 8 to 5 on Monday through Friday, and from 1 until 4 on Saturday and Sunday. So the weekend hours aren't very long, but we are open all day.
It's a large museum for this area.
It takes a long time to get through it.
It
It's a long
does,
time to get
actually.
through. It's got
It
a lot of
does.
information.
We have a couple of exhibits right now. So thank you very much.